Good afternoon.
Hi. Welcome to our Career Spotlight session again. Today our Career Spotlight is for nursing. So it's my pleasure to introduce Annalee Whitman from the UAB School of Nursing. Among her many qualifications, Miss Whitman holds a Bachelor's in Science and Business from UAB and a Master's in Public and Private Administration from Birmingham Southern. She's over 20 years experience in healthcare recruitment, working specifically to manage and recruit nurses, physicians, physical and occupational therapists, nuclear medicine technicians, and more. Prior to working at UAB School of Nursing, Ms. Whitman worked for 15 years in the hospital as a human resources manager, specializing in recruitment and employee relations, where she helped establish new clinics and hospitals in the Birmingham area. She has an absolute passion for working with students and travels around the country recruiting students to UAB, as well as, and this is more important as well, to helping students from our nursing graduate students secure positions. And actually over 75 to 85% of our students get a job offer upon graduation, which is huge. So we're honored to have you join us today, Ms. Whitman. Thank you so much for taking the time to be with us, and I'll let you take the floor. Thank you.
Absolutely. Thank you so much. I am so excited to be with you today, and I appreciate everyone who's joined us live. I hope that I'll be able to talk with you and have a great discussion after we have a little bit of a presentation here. So as she mentioned, I have been with the School of Nursing going on 6-7 years now. And so my passion really right at this point in life is just helping our students get to where they want to go. And so I've worked in the healthcare field for quite a while. And so I've always had this connection to specifically working with nurses, whether it's physicians and nurses, but on this healthcare side, and finding that niche within nursing and knowing what specialty areas that they're looking for. And so I'm not a clinician myself. I've been on the business side of healthcare. And so it's just kind of always kept me in the midst of exactly where I wanted to be. So I can speak the language. You might hear me talk a lot about the lingo of nursing. I've just been in it for a long time. So I do speak that lingo, but I am not personally, I do not have the RN background. So that is something that I think is important to know, because as you start to look towards your education, there are so many directions that you can take in the medical and healthcare industry. And so one of the things that we're going to talk about and that I highly encourage is that you get some experience, volunteer shadowing, to make sure that what you want to do and what you think you want to do is exactly in line with what your expectations are. And so that is a really important piece of this. And so as we talk today, you're going to hear me talk about several different opportunities. And so I'm going to kind of go through a couple of slides here. And one of the things that for me is really important for you to hear today, hopefully all of you have had a chance, is specifically with the schools that you're attending, you've got some great exploration programs, and we desperately need you to look into the nursing field. You can see here just from the statistics, the number of nurses who will be retiring over the next few years. And so it's imperative that we have up and coming students come into the healthcare profession, specifically to become registered nurses. And in a minute, I'll tell you the many ways that you can become a nurse. But right now, and specifically over the last year with the pandemic, it's even more imperative that we have well-educated students go forward into the nursing field. So I do hope that you will give it a chance and do that exploration to think about this field. So UAB is really unique, and we are known around the country and really around the world for the education that we provide for nursing students. But there's lots of ways that you can, right, become a nurse. So we start at the bachelor's level for nursing. So we do not offer certificate at the undergraduate level. So no LPN, no associate degree, and no CNA opportunities at UAB, only at the bachelor's level. So it would be from your freshman year all the way through graduation. It would take you 4.5 years to complete your bachelor's degree. Now, we do have an opportunity if you decide one day to start with the community college system. There's something where you can go and get your associate's degree, graduate in 2.5 years, and then go to work at the hospital with your associate's degree as a nurse, and then finish your bachelor's with something we call the RN to BSN. And so that is a great opportunity for students who are trying to kind of balance their finances, or maybe their community college is closer to home, so it's a better fit there. And so if that's a pathway that's a better fit for you, then I would definitely look into that. There's some great community colleges in the state of Alabama. And then lastly, let's say that you're just not sure about nursing and you decide to pursue a non-nursing bachelor's degree in college. You can go into any major, whether it's history, biology, theater, and if you decide you graduate with that bachelor's degree and you start your career and then all of a sudden realize that you wish you would have gone into nursing, you can still become a nurse, right? We still offer opportunities for you to become a nurse. So there's something called the entry-level master's into nursing, the accelerated master's program. And so I'm not going to spend too much time talking about that today, because that is something that you would kind of explore later on after you finish a bachelor's degree, but just know that it's out there. So if you know someone who's in that position right now, or if you are on the fence about what you want to do and decide to choose another path going into college, then that is an opportunity that will always be there for you. Our newest degree that we have just started to offer in this past year is the Joint Enrollment Pathway. The Joint Enrollment Pathway is a partnership program between two community colleges and UAB School of Nursing. This option would allow you to complete the 2-year associate degree nursing program at either Jeff State Birmingham or Wallace State Hansville, and also do your bachelor's, the RN to BSN with UAB at the same time. So why would you want to do this? Students who do this program would want to look at this opportunity because, again, maybe the cost, because it could be cheaper, more affordable to do the associates at the community college, and all of your clinical classes would be at that campus. And then you would do 9 of your bachelor's courses with UAB in an online format while you're at the community college campus, but you have a UAB faculty member. So when I talk to students about this program, I always say, if you want to apply for both the traditional bachelor's and the joint program, you absolutely can. It's kind of like putting your eggs in more than one basket, right? To help you be competitive. So if you're looking for those multiple opportunities to be competitive, this is one way to do it. But at the end of the day, every decision a student makes, it's a very personal decision, because you've got to decide, maybe one school's offering you more scholarship opportunities, maybe you want to be closer to home, right? So everything that you think about, it's all going to come down to what's most important to you in making that college decision. And I am happy to always talk to you about that. And I'm going to leave our questions about graduate school for just kind of a little bit later in the conversation. But one thing that UAB is known for is all the graduate opportunities that we offer. And one thing I would love to see from you all is kind of getting the conversation going in the chat box about the types of nursing jobs, number one, that you're interested in, and 2, I want to challenge you to think about all the types of nursing roles that you may not have. Number one, have you heard of everything that you could possibly do in nursing that's not at the bedside, right? So let me give you an example. Something that we offer at UAB is a certificate program at the graduate level in forensic nursing. Forensic nurses are someone who work alongside law enforcement or in the court system, and they help in different court cases, or maybe there's been an assault victim in the hospital who's come in, and so they follow up behind law enforcement to ensure that that patient gets the best care possible, so that when these cases do go to court, then we've got all the clinical assessments that they need to be sure that we can get the best possible conviction to that case, right? So that's really cool, and something that a lot of people haven't heard of. There are so many things that you can do in nursing that aren't just at the bedside, right? Your traditional nursing roles. So give me some ideas of things that you might have heard of in nursing that aren't those traditional nursing positions. I typically can come up with about 25 to 30 off the top of my head. And at the end here, we'll kind of see what you come up with. So on this slide, this is just a visual. Some people are visual learners. Some people like to hear things that I've just said. So this is a visual of what we just discussed. So at the top here, you see where I've shown you and talked a little bit about the BSN program. This is that traditional on-campus option. This is the joint enrollment pathway. And what I want you to notice here, these take the same amount of time. All right, and I'm going to show you in a little bit the classes you would have to complete in order to get that degree. This is the AMNP, that accelerated program. And the only reason why it looks shorter is because you would already have had a bachelor's degree. Okay, so don't look at it and think that, oh, I'm going to do that one because it's shorter. That would be a deception in this case. And then lastly, here is your associate's degree. That would be a great option for students who want to start with their 2-year degree. And then you have the option to do the RN to BSN at some other point in time, if that's a better option for you. And again, one of the reasons why students might also choose this option is because a lot of hospitals will help you pay for your bachelor's degree. So if you're looking for assistance in getting your bachelor's degree paid for, that could be a great option. All right. And then everything else you see on here, these are your graduate degree options. So again, I can come back and talk to you more about that in just a little bit. Once you finish your bachelor's degree, everything else with graduate programs can be completed in a distance format or online for the most part. There's one program where you have to come back to campus, but everything else can be completed online. So why UAB? So UAB School of Nursing is one of the most well-known programs in the country, I mentioned earlier, but you can see here our competition. So we're competing against schools who are some of the best in the world. And so our competition, when we think about who our competitors are, we're really talking about people who are outside the state of Alabama. We're always trying to be the absolute best in the country. And we're also trying to be a very affordable program for the schools who are the best in the country. So when you break out both the public and the private schools who are listed on this screen, UAB School of Nursing is typically the most affordable, if not the second most affordable school in the country for your nursing education. We're also, even though we're listed 15th, we just got our new ranking, we're 13th in the country, but our ranking here is based on public and private schools. If you look at just the public schools, we're actually ranked 8th in the country overall. So we're so proud. We work really hard for this. And I know this can be a little deceiving because national rankings, you hear about those all the time. People talk about them, but where it's important for you is that if you think about how sports programs and things like that get a national ranking, this helps you because this comes into play with whether it's your facilities, the instructors, and the quality that you get with the format of that instruction, the quality of those partnerships that you'll have within the program. In the School of Nursing, you're going to have the opportunity to work in collaboration with the other programs at UAB, such as the medical school, physical therapy, occupational therapy, dentistry, optometry, said physical therapy already. Let's see, public health. So clinical lab sciences is a good example. So you'll come together and learn how to work on teams or in partners and partner programs. And the great thing about that is when you graduate, you're going to know what it's like to work in those collaborative teams, right? Because you've got to know why that's important as you transition as a new graduate student. I apologize, guys. My slides are stalled just a little bit, so it might take us just a second here. So let's talk a little bit more while this is kind of catching up to pace. It may fast forward in a second when it decides to hurry up here, but also another couple of advantages of the School of Nursing specifically is that you're going to have an advisement process at UAB. So we partner you with an advisor from the moment you're admitted to the program. So if you think of me as your biggest cheerleader, your first point of contact, you're going to have an advisor who works with you the entire way through the program. So you connect with your advisor when you come in up through your sophomore year. And that's typically the end of your sophomore year is when you apply to get into nursing school. Once you're in the nursing program, from there, you're actually going to have a faculty faculty advisor. So you move forward from there with your faculty advisor. And again, you have a mentor the entire way through the program. And what the advisor does is they're going to make sure you're on track with your courses. If for any reason, maybe it's your first time away from home living on campus, or you're just not sure who to go to for help on campus for tutoring and things like that, then they're always going to be monitoring those things for you. Think about them as a parent away from home, right? So you can always go to them for resources and access to things. You'll see that I've got pictures dotted throughout the presentation. Since we aren't doing in-person tours right now, I wanted you to get a feel for what it's like to be on campus. So we were talking just before you came into this presentation that we've got a brand new renovated building there at the School of Nursing. So the picture down there at the bottom is from inside the building. And our second and third floor are student spaces, what we call our student zones. So the second floor is a place where you can go to study. You can heat up your lunch. There's a kitchenette there with your refrigerator, microwave, a snack machine, all that good stuff. But you can see it's a good place to hang out in between classes. The third floor is a place where we call it the quiet zone. So versus the second floor where you go and kind of hang out between classes with friends, or you could study there if you like to be in a more socialized space. The third floor, if you are a person who needs that quiet time when you're studying, then you can go to the third floor. And it looks very similar. You can see there's more of a pod set up there on the third floor. On the first floor, however, the first floor is where our labs and classrooms are set up. So you can see here in this picture, this is a picture of one of our classrooms. There are 3 large classrooms down on the first floor, and this is where you would have class. So we are really proud of what these design of the spaces look like. They are really engaging. There's a lot of technology in these spaces. And then on the other side of the first floor is where our lab and simulation spaces are. So you'll see those in just a minute. Part of your freshman year, when you get to UAB, there's something called the Freshman Experience course, or FYE. This is really an orientation class. So if you select nursing as your major, then you would have this course, and it's really an introduction to what you can expect as a nursing student. We don't want you to just kind of get thrown in and then not know what to expect. So what we are hoping for you is that we're going to set up times to kind of give you an idea and concept of what it's going to be once you get past your sophomore year. You're going to go in a shadowing rotation over at UAB Hospital. You're going to come over to our labs and do simulation rotations. And so we're also going to have NCLEX questions, which is the test you'll have to take when you graduate as a nurse. We have no expectation that you know how to answer those questions, but the goal is that you have a little bit of an idea of what to expect when you get there, right? Now, if you get into your shadowing rotation and you realize, this is not what I thought it was going to be, or I cannot handle the sights and the smells and the sounds of what's happening in this environment right now, right? Then the goal, the reason why we do this your freshman year is we want to talk about the engagement that you're having with patients. Maybe you thought that nursing was going to be something different in that engagement. So we want to discuss that. You're going to write a paper on it, right? It's typically a brief paper of your experience. But your advisor is the one teaching this class. So if you don't enjoy what you're doing as a nursing student, as a preview of what nurses do, then this gives us enough time for you to change your major. Maybe you would rather be a speech therapist, or maybe you would rather be the MD and work more so on the diagnosing side of the patient's care, right? So it's all about getting some exposure to what you're going to be doing in the role so that we can help you make sure you're in the right space. So I mentioned labs. Labs are a really important part of what you're going to be doing in the School of Nursing. So you always start with your lecture, then we transition into the lab experiences. Once you have shown you're proficient in your lab experiences, you transition over to actually working with live patients. Well, our lab experiences, what you see with these mannequins, they are very lifelike. So you're going to have, from the moment you start in your first semester of nursing school, you'll get those lifelike experiences, and you will actually start going over into your clinicals at the hospital. We have multiple labs. So we have a bed lab. The bed lab kind of looks like a pre-op or post-op setting. So there's going to be multiple beds lined up against the wall, and different curtains that you can pull back if you've known someone who's had surgery and you've gone in afterwards. That's very similar to what this setup looks like. When you're in your first semester, some of the things that you would be doing is learning how to communicate with the patient, how to move a patient to and from the bed, to and from the wheelchair. And each semester, these skills are going to get more and more difficult, right? So you'll ultimately be going through the lifespan of a patient's care. So we go from birth to death, right? That's the purpose of learning that full life cycle. So you'll learn things like wound care, intubation, and catheters, and all of this stuff. So we're going to make sure that you're fully competent in order to be able to care for that person 24/7. The other labs, some of the pictures you see here up in the top corner, and actually both of the corners here, is going to be our competency suite. In the competency suite, these are going to be our most lifelike mannequins. They can do anything that a real human can do. So they can blink, sweat, cry, have a heart attack, a stroke. They can talk back to you, which is a little bit creepy. They'll follow you around the room with their eyes. So there's a lot of things that we do to utilize those experiences to ensure that you're getting a real life experience in a safe environment. Right. So last week, we were just talking earlier, last week, we were doing our OB and PEDS simulations, so obstetrics and pediatric experiences. We also do different things, right? I mentioned earlier, we go through and do different cycles, life cycles. So at least once a year, we do a catastrophic simulation. So it could be a bus crash, a plane crash, tornado. So that's something that we set up, and we'll have the whole entire floor set up, because as a nurse, you never know what's going to happen when you walk into the hospital that day. So we've got to make sure that you're prepared to be ready with the critical thinking skills. And it's an exciting part of your learning process, but we've got to ensure that you're ready for it, right? A couple of other examples of the labs that you'll have here are, you actually have a nursing home health suite. So some of our students won't work in the hospital. That's not their desire. They want to actually work within the community. So we actually do community health rotations. This nursing home health suite that's down in the bottom here looks just like an apartment. We have some money that was donated from Alacare Home Health Hospice. So if that space, you're kind of thinking, I mentioned earlier, forensic skills. You go in and you're looking for clues around the room. What is something that could possibly keep that person, it could cause that person, let's say, let me reword this, could cause this person to be readmitted to the hospital, right? So maybe your patient is sitting in the chair. You walk into their home, they're sitting in the chair, and they've got their oxygen tank beside the chair, but they're also smoking a cigarette, right? That's obviously a hazard. Maybe they're in the bed and there's a lamp by the bed. They've got the walker beside the bed. They're trying to get up, but the cord from the lamp is right going across the room, going under the rug. Easy trip hazard there. Sometimes it's a simple thing. Sometimes it's that there's no food in the refrigerator, right? So we can catch those things early and try to bring in other resources. Maybe we need to call the social worker. I mentioned earlier those teamwork concepts where we call on our peers from other areas. So we need to call on our peers to come in to help us in these cases. Sometimes the family member who is supposed to be helping care for our patient is not able to care for themselves. Maybe we walk in and they have a gun to their head, right? So it can be a very serious situation. So there's a lot of things to take into context when you're walking into a stranger's home in this case. A fun lab that we'll have for you to practice in is what we call the open lab. This is a place where you will walk in, think of it like a study skills for your lab skills, excuse me. So a study space for your skills. So the open lab has a wall outside that tells you Monday through Friday when you can go in and practice. There's an educator here who helps you, and it's up to you when you go in, how often you go in there. So you can kind of see in one of these pictures, the gentlemen are working with the arms, what we call the task trainers. And so they're inserting IVs, it looks like, doing medication administration through IVs there, or taking blood. I can't really tell from the exactly, I don't have my glasses on there. So, but they're working and doing practice to make sure that their skills are competent before we do checkoffs. And that checkoff is what you do, again, to show that you're proficient in skills, which is a little bit different than a test exam. But we want you to spend as much time in there until you feel confident, right? So that's a fun place to go in and get hands-on experience, and you spend as much time in there until you feel like you've got it. If you're struggling with something, let's say that you're practicing blood pressure calculations and your math skills they aren't coming out correctly. Our educators will walk around the entire floor checking off everybody's blood pressure until you know that you've got it, right? So that's just an example, but that's what the educators are there for. And the educators will be different than who your faculty are, because everybody has a little bit different learning style, and we want to make sure you get to hear different points of view. So, all right, let's move on to this different slide here. So we talked earlier, kind of hinted to our clinical partners. We have lots of different clinical partners. So I'm going to tell you in a minute about the size of your classes, but one of the reasons why we have the size of class that we do have at UAB is because we are so fortunate to have access to clinical sites. So you're going to be able to walk across the street to go to 98% of your clinicals. And we do a lot of your clinicals at UAB, but we don't do all clinicals at UAB. UAB is a level 1 trauma center. They can see any patient who walks through their doors. They go as far as Africa to transport patients. They're an incredible transplant site. So they're one of the largest transplant centers in the world. They're also a 5-time magnet facility. There's only they're one of 21 hospitals in the entire world who've been designated 5 times. And what that means for nurses is that the nation has said that they are one of the best places in the world to work as a nurse, which is really cool. And that also means that they have great recognition in working with the physicians there at the hospital. Connected between UAB on the 2nd floor is the Women and Infants Center, and that connects over to Children's Hospital. So UAB and the Women and Infants Center see right around 1 million patients a year, and Children's Hospital themselves, between the hospital and the clinic, see right around 1 million patients a year, which is incredible if you think about it. That's a lot of patients. But Children's Hospital serves our entire state for pediatric populations. They see 97 to 98% of all the pediatric oncology patients in this state. So we are so fortunate to have them right across in our downtown area for you to be able to get clinical access. So we are also in the School of Nursing. We are one of 14 schools of nursing that is a partner with the VA. So we have a national partnership with the VA. And if you are interested in going into the military, or you have a special place in your heart for serving veterans, then this is a partnership where you can do a good number of your clinicals over at the VA. And our goal in the partnership is that you would get a job at the VA, which is a federal job, which is a really good job. So if that is something that you have an interest in, or is just, like I said, some students just have a heart for serving and giving back to our veterans, then keep that in the back of your mind, and we can definitely tell you more about that. Those are a few examples. I'm not going to go through all of them, but we don't, again, just do clinicals there across the street. We go to places like St. Vincent's, Brookwood. We also go to Lakeshore Rehab. So they are home to the training for our U.S. Paralympic athletes. Our students get to do rotations with a lot of Olympians. You'll get to do rotations in the community. So we do not do international mission work in this program. You will not have time to do that during nursing school. However, a lot of the work that we do in our community, we try to mimic that so that students who want to go abroad and serve in nursing mission work, they get those same types of preparation in the work that we do in our community. There is so much we can do to give back in our community, and that's our focus here in the UAB School of Nursing program. So you're going to get lots of rotations there in your own community. All right, so let's talk about admission to nursing school. It is a little bit different than most programs because it's a professional program, kind of like going into med school, right? However, you're actually applying to the program as an undergraduate. So that's different than any other professional program. The first step is always to be admitted to the university. So in this case, you'll apply to UAB and you have to complete your prerequisite classes. So very important. The second part is once you are in your final class, your semester of classes, that's when you're going to apply to nursing school. Now, you don't have to worry about remembering when to do that as long as you're at UAB. Your advisor tells you when to do that. I have a little note down there. If you're planning to go to a community college first, or maybe you're planning to go to another university first and then transfer to UAB, it is important for you to remember to apply to UAB when you are starting your last semester of your prerequisite classes. So just keep that in mind, and I'll show you what the prerequisites are here in just a second, okay? We admit students twice a year in the spring and the fall. All right, so 2 times a year. And in those classes, we accept somewhere between 130 and 150 students. So total around 300 students per year, which makes us the largest class in the state of Alabama. And again, we can do that because we have the access to our clinical sites. But when you start nursing school, you're going to have to go straight through the program. All right, so we're going to go completely through those 5 semesters in nursing school. And we do have scholarships available, and those are separate from university scholarships. So I can tell you more about that here in just a little bit. So up at the top, that picture there, that is actually from one of our disaster simulations where we had a tornado that came through. So we had to wreck one of our labs there so the students can practice after a tornado. And if you don't know who Nurse Blake is, just for fun, he is a comedian. He's a nurse, he's a comedian, but he's a lot of fun if you haven't seen his social media sites. So he's just kind of gives you a little bit of relaxing fun if you ever want to take a look at his social media. We have him come and visit sometimes. All right, I want to really highlight what I'm about to say next, because for students who are getting ready to finish up in the next, well, really the next couple of years, or if you are about to graduate this year, UAB has a very special program called is an early admission option, okay, the Dean Scholar. This is not a scholarship, it is a designation. If you have a 3.2 or higher GPA and a 25 or higher ACT score, we will hold a seat for you in the nursing program while you finish your prerequisite classes. All you have to do is maintain a 3.0 overall and a 3.2 in what we call your core nursing classes, which I can tell you more about in just a second. But essentially what this is a guaranteed seat in nursing school as long as you maintain your grades when you get to UAB, all right? There's really no other option where you can get this kind of assurance that you're gonna have a seat waiting for you. I do want to acknowledge that I know that things are moving toward a test optional policy. So I do want to acknowledge that. What we are doing for students who came in, if you've applied already to UAB as test optional, you have up until December of your freshman year, so December of 2021, that you can take a residual ACT. And if you get the 25 ACT at that time, then we're going to automatically move you over to the Dean Scholar. Okay, so we want to make sure that everybody gets a chance to have this status if that's what you want to do. Just because you're not a Dean Scholar does not mean you won't get into the nursing program, but it's just an opportunity if you would like it. And please let me know if you have any questions about those options. All right, so I keep mentioning those prerequisite classes. Let's talk about those for a second. These are your prerequisites that you would complete in typically your freshman, sophomore year, all right? But it's totally up to you how fast or slow you complete these courses. So when you're looking at these, we break them down into core areas. This is area 1, 2, 3, 4, and 5. And this down here is your orientation class, so it's kind of separated off. If you have taken AP or dual enrollment credits, we will accept those for anything in area 1 through 4. Okay, so anything in area 1 through 4, AP and dual enrollment credits, we will accept those. If it is listed in area 5, we want you to take those courses at UAB. All right, so keep that in mind. Now, if you're planning to transfer, this is a different conversation. This is for students who are planning to come to UAB straight out of high school, but you can choose to transfer to UAB and take these courses somewhere else. So All right. Again, please let me know if you have any questions about those. Once you are ready and you finished your final semester of your prerequisite classes, you're going to be ready for your core nursing classes or your true clinical classes. So these are your 5 semesters of your nursing classes. You have to go through a sequence of 5 semesters. So once you start these courses, you are our student. You cannot stop. And the reason why is because just like you saw this past year, healthcare changes so fast, right? There's so many developments that if you were to take a semester off, it could put you behind really quickly. So we want to make sure that you finish in a sequence. What this means is that if you start in the fall, you will have at least 1 summer. If you start in the spring, you're going to go 2 summers. Okay. So just if you count these out, that makes sense. When you're going through, you'll notice that there are those core classes where we talk about the lifespan. So you'll see the difference between the adult health classes, behavioral health. Pharmacology is where you learn about the drugs and their interactions, the name of those drugs and the concepts. Things like the difference between public health, population health, and then the OB and PEDS I mentioned earlier, basic concepts of skills. And in your 5th semester, the 5th semester is a little bit different than your 4 different semesters that you had previously. In the 5th semester, we do what we call a preceptorship. The preceptorship is where you're actually going to be working one-on-one with another nurse in the hospital. And so this is that entire course for that semester. Once you finish that, after you're finished with that semester, you sit for an exam, and that's the NCLEX. But during that 5th semester, we do our best to try to align you with the area that you're hoping to work in before graduation. So we can't guarantee that you get the specialty that you want, but our goal is to try to align you in that area. So the NCLEX, the exam that you'll have to take before and prior to graduation, this is really very important. I encourage you to go to the board for any school that you're considering and look at these scores. And I need to update this slide. We actually just got our new averages from the board in the past couple of weeks. So we stay between that 96 to 97% average. And if you compare that to the national average of 85%, that's a pretty drastic difference, right? So the other piece that I would like to point out here, and the reason why I put the number of students that are taking the exam for us is because it is I won't say it's easy, but it should be fairly easy for a class who has 20 students or 30 students to be at that 100% pass rate. For a class that's almost 300 students to be close to 100% pass rate is very difficult. So do keep that in mind when you're looking at those pass rates, because you want a true authentic look at the school that you're trying to choose from when you're comparing schools, because that tells you the type of experience that you would have coming through. You don't want to choose a school that teaches to the exam. You want to be prepared clinically so that when you are ready to take the exam, you understand the concepts for the exam. So we're not all just, work in labs. We do have fun here in the School of Nursing. So a little bit about, we're competitive. We are a lot of type A personalities in the School of Nursing, but we have an honors program that you are encouraged if that's something you want to do. And it is different from university honors. So when you finish your 1st semester and you're starting your 2nd semester of the nursing courses, that's something that you just to keep in mind, because it gives you the opportunity to be connected to some of the faculty in our graduate program. So for those of you thinking about maybe becoming a nurse practitioner or a CRNA, a nurse anesthetist, or maybe you want to do research, maybe you're interested in oncology research, something like that, then this is a really great way to start talking with our professors at that graduate level and get to be involved in what they're doing, whether it's their clinics or their research. So stuff that we don't have time to get into when you're doing your clinical work at the bachelor's program. We also are very involved. We have our own softball team, kickball team. We love to be involved in homecoming and things like that. We have a Student Nurses Association. The Student Nurses Association is something you can be involved in. you're starting your freshman year. And I would encourage you to think about doing that if you're able to. You certainly don't have to. But the benefit of doing something or being a part of a group like that is because think about the simple things other than camaraderie, right? With people who are doing what you want to do. We're going to definitely tell you what courses you need to do. But there's going to come a time when you've got to decide between multiple professors, right? Who better to ask what professor you might should take for this course than the person who just took the class, right? So they're also doing a lot of community service and volunteer work. So they're going to have a lot of activities that you can join in on. And that's something that you can definitely put into your resume. So just things that you can be involved in at UAB, but that is very specific to the School of Nursing. As you move forward, these are just things that I talk about, steps that you can consider. And so financial aid is always going to be important. If you have not checked out the financial aid website at UAB, the thing about being virtual now, it has given us great benefits. So they are doing a financial aid session at UAB every day. So if you haven't checked them out, I highly recommend it, especially that we've gone to the test optional piece. Rather than just looking at your ACT, they're also looking at GPA. So if you choose test optional, all your scholarships are based upon your GPA. So you need to know how that impacts you for scholarship opportunities. You also want to know what are the other ways you're eligible for scholarships, right? I mentioned earlier that the School of Nursing has scholarships available in addition to university scholarships. And so when you are offered admission to the School of Nursing, you're going to receive information about how to apply for nursing scholarships. And we are very fortunate in the School of Nursing. We gave out just right at $1 million in scholarships this past year to our students. And so that is something you'll be eligible to apply for every year. So I'm not going to touch any more on the volunteer and shadowing other than to say, focus on that your freshman and sophomore year, right? And I know that's been really hard with COVID this past year. I hope that since you're coming into that, hopefully post everything that will be a little more open than we have with those opportunities. But if for any reason the hospitals still are not allowing volunteer shadowing, we are looking at some alternatives within the School of Nursing to give you interactions with faculty and other researchers so that you can hear more from professionals, right? So let's see here. I've kind of touched on everything else, so I'm not going to keep harping on the things I've harped on already. I do want to make sure I again touched on the joint enrollment option. If anybody has questions about those, the joint enrollment option was the combination of the UAB BSN program and the associate's degree at either the Jeff State Birmingham campus or the Wallace State Hansville campus. All right. And so there's two different opportunities there. So, all right. Let me make sure as I'm finishing up, I want to make sure I go back and look at everybody's questions that I might have missed. This is my contact information, guys. I'm going to go ahead, please open, I want to open it up for questions and see if anybody has anything specific that we didn't touch on that you want to know more about. I'm happy to talk to you about graduate specialties. If you want to hear more about what UAB is known for at the graduate level, how to get into those specialties once you finished up. You know, at the bachelor's level, you're going to be more of a generalist. You're able to choose what kind of experiences you want to get post-graduation. So if you wanted to work in trauma and burn center, maybe you work in transplant, or you want to work in the emergency room, in the NICU, the neonatal babies, whatever your interest is, you're going to be able to apply for those jobs after you finish the bachelor's program. It's up to you after you graduate to decide if you want to come back to school to get advanced education. And that's where you can become a nurse practitioner or the nurse anesthetist or get your PhD in nursing. You can become a midwife. There's so many things that you can do beyond your bachelor's degree, depending upon what your interests are. So, you know, I don't want to kind of assume what your interests are. So.
And before we open up to starting to answer questions, could I bring everyone's attention to the Google Doc link that's in the chat? If everyone would fill in Google Doc as we're listening for questions and answers. And Annalee, if you want to maybe pop your email address in the chat as well, and then you can stop sharing so that we can see everyone's beautiful faces.
Yes, absolutely.
So we have one question. I think Carolyn Williams asked about the joint enrollment program, and you covered on that. Carolyn, are you still with us?
I'm here.
So did that cover your question about the joint enrollment pathway?
It did. Thank you.
Great. And then we have another question: what keeps students motivated through nursing school, or any school for that matter?
That's kind of a loaded question. Every student's a little bit different in what motivates them personally. And this past year has been really difficult because I think that trying to connect with students and find how we can make sure that we're giving our students what they need to find that intrinsic motivation has been really difficult. Part of what my role is not only recruitment, but engagement. And so we've just been trying to do those little touching base with students to make sure they're okay. And not just myself, but it's everyone, right? Recruitment is not my job only, it's everyone's job. And so is engagement. And so I just kind of am the cheerleader for what we do. And so, but we do little things. We've done stress reliever activities. We've done, let's say, yoga, meditation activities, just anything you can think of to try to do that checking in with students. And there's some days where we've just kind of had to back off, right? And UAB as a whole, they've had days where they've canceled classes and have wellness days. That's been a big part of the university piece, but keeping students motivated for nursing school, I would say, is starting out where we were talking about getting the volunteer shadowing. That's been a big piece because there are going to be times where you're in courses and you are having a tough day, or it's a course that you're not as interested in, let's just be honest. And so if you've had the opportunity to interact with people in the profession, you've shadowed and you've seen something that maybe you just had a great experience, right? And so this is what you want to do. You look back on that and you can say, this history course is just not my thing today. I'm not excited for this exam, but I am so pumped about that rotation I had at Children's or the VA or UAB, and what I saw, that interaction between that mother and that nurse that day, right? And just how they communicate with one another. And so that's what's going to push you through, is looking back and knowing that that's where you're headed. And so that's why we want you to have those experiences. And I applaud you guys for the programs that you're already in your high schools there, because not every high school offers what yours do. And so when you do look at these shadowing and mentoring opportunities, they're not all going to be glamorous, because you're not necessarily going to have the skills that you need to put your hands on patients every day. But everything that you do matters to a patient. Everything, whether it is sitting behind a desk, whether it's taking a phone call, everything you do matters. And think about whoever that patient is being someone who is your friend or your family member, and just think about making their day a little bit better. And if you can think about it from that end, everything that you do hopefully will keep pushing you forward, and every experience will matter that much more. And if you come into these experiences with an open heart and an open mind, the nurses who are working with you, even the physicians who are working with you, are so much more likely to say, hey, come along, I've got something I think you might want to see, right? And so it's just that willingness to be there and to listen, or to just be available. And you never know. It's hard to say this, and this is going to happen. Sometimes it's just being there and being available.
If I can add to that as well, in regards to motivation, one of the biggest things for losing motivation is if your grades start to slide a little bit. And I know that the faculty are willing to help. So if you find yourself slipping a little bit, then reach out. Don't be ashamed or afraid or anything to reach out to get some help with your academics, because there's a snowball effect with that, and that will surely back off on your motivation, cause you to back off on your motivation. So you know, we're all built differently, and we all have strengths in one area and not another. So maybe history is not your thing. It certainly was never mine. So you know, if you find your grades aren't so good there, reach out to those mentors, to your faculty, to TAs, whoever is available to you, and get your grades back on track. That will re-motivate you to move forward.
Absolutely. And I would tell you one thing about UAB is that we have so many resources to that effect. And so no one is going to tell you, okay, go figure it out yourself. You know, we may try to direct you to help you and say, hey, I want you to push a little harder, but no one is going to force you and leave you on your own. We're going to do everything we can to make sure that you've got what you need to be successful. And to me, that's one of the most incredible things about our advising structure. So I am very proud of what we do at UAB to get students to where they need to be. So
maybe if I teach the physiology and the nurse anesthesia program, so maybe in a few years, come and say, hey, if I'm still here and you join that program one day, come and say hello. They're a great group of students in that program. So they're, you know, and I can tell that the faculty, if I could just piggyback off what Ms. Whitman's saying, they really want you to succeed. So that, you know, it helps everybody. It helps us for our school. It helps you for your career. So just reach out.
And if I could give a tip, you guys are going to come across some things that I don't want you to not pay attention to them. So we were just talking earlier before you got on that there are some summer programs that come across at UAB, and they're not necessarily through the School of Nursing, but School of Nursing is connected in different ways. So there's the summer program, the SHIP Week is called SHIP-EP, affectionately. And then there's also a program it's an occupational health and safety program through public health. To me, these are huge resume builders. And so if you are looking, and maybe you're looking at nursing, but you're also looking at other opportunities, take advantage of anything and everything that comes your way that you have the opportunity for, because this is college, right? There's not many times in your life where you can take a chance to step back and step into something that you might not have had time to do before. So pick up on these things. And again, what it helps you do is build a network of people that you will get to know later on, and you could use as references and things like that. So to me, those are big opportunities that UAB has to offer for each of you. What other questions do you have for us?
I have a question for the students. So I wanted to know, we've talked about nursing today. So are there any students that know what type of nursing they're interested in doing in the future that they would like to share with us?
Don't be shy.
What?
Let's see.
Nobody want to share? Okay, so I'll tell you.
I one student that put it in the chat.
Okay.
Pediatric.
Kia.
Great. That's wonderful. Pediatric cardiology, that's a big one. Carolyn, you used to had some ideas of what people wanted to do?
Oh, no, I was saying, I'll tell you, like, I'm so interested in learning more about different types of nursing because, like we were talking about earlier, a lot of people say, I want to go into nursing, and they say it like it's a very general statement. And there are so many different types of nursing that, you know, people can go into. So there's like sports medicine. You can be a nurse in like an orthopedic clinic or something like that. You can, of course, work with children. So I'm looking forward to seeing what comes out of this class and what the students end up doing in nursing and in other medical fields as well.
Yeah. So I'll kind of go through, I mentioned earlier, I was kind of asking if anybody could give me some ideas of things that weren't just the hospital nursing based concepts. And in my presentation, I kind of referred to a few with forensic nursing, the home health and hospice. One where I actually have a few friends who do legal nurse consulting. So they had this interest, they were nurses, but they also had this background interest in doing legal work. And so they're consultants in their specific areas of interest. So they go into different court cases and are expert witnesses in those areas, which is really cool. And a lot of people have no idea that that exists, but you can get certified as a legal nurse consultant. And so they get paid consultant fees to travel across the country to do that kind of work, which is really cool. One program that UAB is getting ready to reintroduce is our midwife program. So we're planning and hoping, as long as everything goes smoothly, that will come back in fall of 2022. So we're pumped about that because that was an incredibly popular program at one point, and then legislation changed here in Alabama. So we'll be working with the UAB hospital to get that program back up and going. But that is where, for anyone who's interested in women's health and obstetrics, then you're working with women who are going to have healthy pregnancies. And so you can do a lot of that stuff outside of the hospital. So that is something that I think we'll see a huge spike in interest. Mental health nurse. So for anyone who's interested in working in rehab facilities and things like that, that's a big one. There's lots of components to mental health nursing outside of rehab facilities and things like that, but just mental health in general. And that one pays very well because there are so many specialties and components to mental health. Nurse educator, right? So I work with a lot of nurse educators. And so you can have a specialty in nursing and then get a certificate on top of whatever your specialization is. And that's how we teach at UAB, because we don't want everybody to just be an educator. If that were the case, then you might not be able to be a specialist in your area. So when you have a faculty member who comes in to teach your class, they actually are teaching to their specialties. And then in some cases, like we were just kind of mentioning earlier, we have some of our physicians from other departments who will come in and speak in addition to that topic, right? Because they are our partners here at UAB. So we do everything we can to make sure that you're getting the best, most well-rounded education possible here to understand the breadth of that topic. Let's see, public health nursing. You've heard a lot about public health since the pandemic, but there's a thing called public health nursing. And so they're working alongside public health officials, to make sure that our communities are health and safety is running smoothly. They're giving vaccines, right? So hopefully a lot of you are starting to get your vaccines. And so, but they do lots of other things within the community and also in our state departments, our health departments and all of that. So again, public health has a lot of different components and moving parts to it. Also within public health, there's the occupational health and safety piece of it. So there are nurses who work in industries, and there's different parts of industries, but the people who ensure that the places that we work are safe environments. So if you ever had a job and maybe it was a larger industry and they make sure that anyone who maybe gets hurt on site and things like that, that they get checked right there in the place of work. So you'll see that quite often, but those are occupational health nurses. Let me think. School nurses, I'm sure you probably are familiar with school nurse. That's a very common one as well. We have at UAB informatics. I just keep listing them, so y'all stop me. Oh, I see traveling nurse. That's a very popular one. A lot of our students want to be travel nurses. So when you finish, Jocelyn, you can actually, usually with 6 months to a year, and I really recommend a year of experience before you become a travel nurse. And again, you heard a lot about this during the pandemic, but after that 6 months to a year, you've got enough experience to start feeling confident in what you're doing. Because as a travel nurse, you're going to be placed in some of the toughest areas where they need help when you're traveling, right? So you want to feel like you're you're ready to go. You've got those skill sets down pat. So that's a big piece of travel nursing. So kind of looking back up here, ultrasound tech. I noticed ultrasound tech, and we talk about that a lot. And if you are not interested in nursing, but thinking about another health profession, let me know, and I can kind of talk to you a little bit about that too while we're here, because I do work closely with our other health profession programs, and we can kind of talk about how you do and get into those areas. But ultrasound tech would be a 2-year degree, so you don't need a bachelor's degree to become an ultrasound tech, but our community colleges would be the best place to go to get your ultrasound training for that. So I would definitely say just to always start with that 2-year degree there, because there's no program at the 4-year level that's going to change your training for ultrasound tech. So that was a good one there. I'm glad you put that in. OB, obstetrics. So there's a difference between an OB nurse and an obstetrician. So an obstetrician is going to be your MD side, and an OB nurse is going to be the person who's working alongside to do the deliveries, right? So with the physician. So y'all are awesome. We've got a lot. We named off a lot there. We have some nurses who are graduates. So we have graduates in all 50 states. We have one who's actually clergy. So she is head of the clergy here, and I think she is, I don't want to say it wrong, maybe Presbyterian here in Birmingham. So she leads a church here, which is pretty cool. So something you wouldn't think about. And then CEOs of companies, of course. So there's lots of things that you can do. You can combine social work and nursing. That's a popular one with case management. So nutrition.
And add to that, if you're interested in research too, clinical research, nurses as well. There's a lot of, here at UAB as an academic environment, we have a lot of clinical research components, and there are nurses that are involved in those. So if you want to be able to publish in the academic literature, if that's something of interest to you, it's quite rewarding to do that too. So it adds another layer to your CV basically. So there's lots of opportunities.
I would say I would go back to where we were talking about the honors program for research specifically, and for the NP programs. That is a great way to start getting connected, because some people are intimidated by research, but going into the honors program, that doesn't commit you to going into research. It just gives you some exposure. And we have undergraduate students who have been published, which is amazing, right? Not every undergraduate student gets the opportunity to be published. So, you just get that opportunity to connect with those faculty members and learn more about what they're passionate about. And at the PhD level, what happens is that you start learning and figuring out what areas of research you are interested in. The difference between the PhD and the doctorate in nursing, the DNP, is that the PhD is producing research, right? They're writing and producing research. The DNP, the doctorate of nurse practice, who's your nurse practitioner, they are taking that research and putting it into practice with their patients. So they understand and can theorize the research, but they are not producing the research. So, and that's kind of a high level difference there. But since there's different kinds of doctorates, I get that question a lot. So, and for our nurse practitioner programs, you can do anything from neonatal up to, we've got family nurse practitioner. They can see anyone from that birth to death life cycle. Adult gero is 14 to death. So if someone's not interested in working with babies, but they want to work in a clinic and have that, 14 and up population, the adult gero is a great program. So we have the psychiatric mental health. That's a great one that students, I mentioned earlier with mental health. So, but yeah, I think I've kind of mentioned everything. I don't want to keep rattling off stuff. And
that's awesome. So if anyone has any questions as before, just let us know. If we don't know the answer, we'll reach out to those that do. So we really want to help you find out as much as you can about careers, so you're really, really well informed. So thank you very much, Annalee. That was fantastic. I'm sure everybody got a lot of information there that will help them for their futures. So we really appreciate you taking the time. And this is our last spotlight session for this year. So thank you for being our last speaker today as well. So If
Thank
anyone
you.
has any other questions, we can try and answer those for you. Oh, Miss Caroline. Sorry.
I hate to be the Google Doc police, but I'm seeing some names on that screen that didn't fill in the Google Doc. I'm gonna enter it into the chat again. So if you would not mind, we need to know who was present. If you would not mind going to the Google Doc and filling in your information. Thank you.
Okay, well, I think if anyone, there's no more questions in the chat we haven't addressed. If anyone has any questions, speak now, or if not, we'll end the session for today. Thank you so much again, Annalee. This was fantastic. Thank you.
Thank you. I really hope, and please don't forget, if you're interested in the Dean Scholar, it's out there. It's for you specifically, but if it's not what you're looking for, you can still always get into the nursing program. You're just going to work and keep your grades up. And even if you're a Dean Scholar and your grades drop below the 3.0, as long as you get your grades back up when you're ready to start nursing school, we will honor it. So, let me know if you have questions. We're here for you. We are excited for you. And I hope to see you on campus very soon. So take care, guys.
Bye, everybody. Thank you.
Oh.